Hello, good morning, students. Today we are going to see major harmful traditional practices. This is the last portion of reproductive health for third year nursing student. Last time we have seen emergency health, reproductive health like post-abortal care and emergency treatment. Emergency treatment when we say like medical treatment and surgical treatment. Post-abortal care when we say like post pills, emergency pills. The other is we have seen sexually transmitted diseases. What are sexually transmitted diseases? Their classification, their sign and symptom, major complication and the challenges. Then we have seen mode of transmission again. Like the major mode of transmission of sexually transmitted disease are sexual intercourse. The other is from mother to child, and the other is through blood and blood products. That means sexually transmitted disease is not only transmitted through sexual intercourse. It can be from mother to child. From mother to child, when we say it can be during pregnancy, during childbirth, and during breastfeed or post after delivery. That is good. Therefore, don't forget to read. Today is the last chapter of reproductive health. That is, as I have told you before, this major harmful traditional practice. What are these major harmful traditional practice? Let me ask you some question. What is a harmful traditional practice means? What are the most known in your community? Why people practice it? And what are the public health impact of this practice? So at the end of the chapter, I hope you will answer these questions. Good. So some of the major harmful traditional practice or those which are the most common in Ethiopia, for example, are like female genital mutilation, uveilectomy, and the others are not which are not as such common: milk teeth extraction, early marriage, marriage by abduction, and food taboos. These are mostly found in most of African countries. It's not only in Ethiopia. Like for example, if you take female genital mutilation or FGM, it is the most common even in Somalia, in Somaliland, in Puntland, even most common in most of the countries. Good. So let's see them one by one. What is female genital mutilation? Female genital mutilation is a traditional operation that involves cutting away parts of the female external genitalia or other injuries to the female genitalia for cultural reason. Its epidemiology is more than 80% of women in Ethiopia, 100% in certain communities, are circumcised. In Somali, 100%, in the lowest Gambela, 2%. But nowadays it is reducing. What are the types of female genitalia or female genital mutilation or FGM? There are major 4 types. The first one is type 1. It's a partial or total excision or cutting of wood of the clitoris. It is called as clitoridectomy. You are going to remove only the wood of the clitoris. This is type 1, which is most common and it is not as such serious. The second one is partial or total excision of labia minora, vaginal inner lip, what we call it, labia minora, with excision of clitoris. Is also called a suna. Sometimes we call it suna. A little bit serious when we compare it with type 1. Type 2 is serious because type 2 means clitoris and the labia minora. The first one is only wood of clitoris. Type 3 is the excision or removal of external genitalia. labia including labia majora, partially or totally, together with the above two procedures. That means clitoris, labia minora, and partially or total removal of labia majora. Following the procedure, the vaginal opening is closed or narrowed with stitches or infibulations or pharaonic incision, allowing a small opening for urine and the menstrual blood to be excreted. The last one is, or the fourth one is, this is any other procedure done together with or other than the above three. That is pricking, piercing or incision of clitoris and or labia. It can be labia majora, it can be labia minora. Stretching of the clitoris and or labia. Cauterization by burning of the clitoris and the surrounding tissues. Scrubbing, that is anguria cuts of the vagina, various of vaginal orifice or opening of the vagina, or cutting, gishering cuts of the vagina. Introduction of corrosive substances into the vagina or birth canal to cause bleeding. This is the most serious. Therefore, these are the major 4 types of female genital mutilation. What is the reason given for practicing of female genital mutilation? What are the reasons? Why the communities are practicing culturally? The main reason are 1. To maintain the moral behavior of women in the society. To preserve virginity again. For hygienic reasons. To calm a girl and make her decent. Aesthetic reason. Religious requirement. Some even believe that the Holy Book says that which protrudes from the body is excessive and should be trimmed to avoid difficulty at delivery, to increase matrimonial and marriage opportunities. So these are the major reasons which are nowadays not acceptable, totally not acceptable nowadays. These have no relation with Quran or with Bible, but our communities are simply culturally accept and they are practicing for this reason. So that what is expected from healthy professional is you should give awareness for the community. These all are not real. So the community need awareness. Good. What are the impact of FGM? The first one can be physical consequences. From physical consequence, 1, immediate complications are there. These are those which arise soon, in a few seconds or within a few days of the procedure, such as, for example, hemorrhage, bleeding, shocking, severe pain, damage to the nearby urinary structures, septicemia or infection, tetanus, bone fracture allowing heavy pressure applied to the struggling girl. Maybe if she's not allowing them, she's struggling, so bone may be fractured. These are physical consequences, immediate consequences. What are the late complications? These are those that occur later on life, like heavy scarring or keloid scar, dyspareunia or painful intercourse. During sexual intercourse, they feel serious pain. That's what we call it, dyspareunia. Hematocolopus, accumulation of menstrual blood caused by closure of birth canal opening by scar tissue. Recurrent urinary tract infections, HIV/AIDS. When we say this, because maybe they are going to use one blade to cut for or to do the procedures for 2 or 3 or 4 girls, so that if one is infected, easily it can be transmitted from one to the other. That's why we say late complication can be HIV. The other is obstructed labor and other obstetric complications, urinary and rectal fistula, usually following delivery. The second one is psychological consequence, lack of sexual desire and or satisfaction, fear of sexual intercourse because they are afraid, maybe it is painful, lack of self-confidence, that means low self-esteem, they are not confident enough. So this is the first one, that's what we call it female genital mutilation, which is very serious and nowadays not practicing. Please try to avoid it. First avoid for your families, then after try to give awareness for the community. The other is uvuloctomy. Uvuloctomy means it's a procedure involving the cutting of uvula and sometimes the nearby structures such as tonsils. Is commonly practiced in the northern part of Ethiopia, for example, but rarely seen in Gambela region. Reason given for this practice. What is the reason? First one is swelling of uvula and the tonsil has been considered a serious health problem and some feel it to be a life-threatening illness. Others, prevention of headache. They are considering as prevention of headache. The other is ensuring a clear voice. The other is prevention of blindness and the change of eye color. So when they do this all is going to happen. That's why this is simply believing. It's not real again. It's not scientific based again. Good. What is the impact of this uvuloctomy? Local complication like speech problem, injury to the tongue through being pulled, broken teeth as a result of struggle, local infection, bleeding, systemic complications, maybe sepsis develop, infection develop, tetanus and HIV again. Others are like milk teeth extraction or early marriage, the most common. Especially this is the most common in Somali region. It can be Puntland or Somaliland or what we call Tigray Somali. Marriage by abduction. Nowadays, if it is not as such common, but it is one of the harmful traditional practice. The other is food taboos. In some region or in some country, some foods are not eaten naturally. So this is what we call it food taboos. Good. Monitoring and evaluation of reproductive health program. How can we monitor and evaluate? First one is education. Education is a crucial, very important. In most of the countries, including Ethiopia, over half of women who undergo FGM have no education at all. In comparison, only 25% of women who have received secondary education or above continued the practice. In 2003, UNICEF created a facilitator training initiative, key personnel in communication skills, HIV/AIDS, legal aspect of HTPs, and the family planning, embarked on a nationwide training scheme or system. So the first one is education. Personnel are trained at regional levels by professionals in Ethiopia from Addis Ababa, in Somalia from Mogadishu, as the nation's regional capitals. These personnel in turn train more people from the surrounding woredas or districts. They train people from local villages with those woredas through community dialogue. Facilitators aim to make communities publicly pledged to abandon throughout HTP. What is the impact? Achievements have been made in areas dialogue and awareness. Latest studies reveal that in 2005, out of the 15,000 women surveyed across Ethiopia, only 25% still supported the FGM practice. This is down from 16% 5 years ago. So nowadays, it is good. It is reducing. Even if in some area like in Ethiopia and Somali region, it is highly practiced even nowadays. National reproductive health strategies. The first one, partners. UNICEF is working in partnership with other NGOs to encourage communities and women to abandon all HTPs, that's harmful traditional practice. The subject is gaining ground as a major public issue resulting from strong social mobilization campaigns. UNICEF Ethiopia is working with grassroots. UNICEF is working not only in Ethiopia, in most of developing countries. Most of developing countries. In Somalia, again, is most common. So it is working with grassroots organization, national association, and the government to prevent continuous practice of all harmful traditional practice. The National Committee on Traditional Practice of Ethiopia and the Ethiopian Women Lawyers Association are both UNICEF partners. So to remove this, partner is one of the main special importance. Since 1992, Women's Affairs Office, now under the direction of the new Ministry of Women Affairs, have been set up in election of Ethiopia regions. So this the ministry level in different country actually they have different names, but it is working. UNICEF is working with other partners. So UNICEF hopes to increase partnership with NGOs working as the front line of FGM protection, like WAO, WARS, and RWY. Why I'm mentioning this, especially why I'm taking example of Ethiopia is when you need to develop a national reproductive health strategy in your country, you should prepare such like a ministry and you should contact such like organization, NGOs, then you can protect what we call FGM. Unless and otherwise, you cannot protect, you cannot stop the overgoing of FGM. So NGO have special role here. Advocacy. Ethiopia ratified the Convention on the Rights of Child and the Convention on Elimination of all forms of discrimination against women. Ethiopia's women policy and the Constitution of the Federal Democratic of Ethiopia also affirm the protection and the well-being of children and women. The implementation of this convention and the Constitution remains a major challenge. Advocacy programs are being rolled out through the country to help victims and most importantly to prevent continuation of FGM. In May 2005, Ethiopian Women Lawyers Association, in partnership with UNICEF, published a small booklet in 5 languages outlining essential legal rights of women. Good. The booklet contains legal information on harmful traditional practices taken from the Criminal Code of the Federal Democratic Republic of Ethiopia, Proclamation number. This proclamation became law in 2005. You should apply. I hope such a constitution is found in Somaliland again. So you should apply this one. Government and other organizations now have increased the power to deal with harmful traditional practices. This information is available at Women Affairs offices. It can be in Ethiopia and Somalia again, the National Committee on Traditional Practice in Ethiopia, as well as school and colleges. Human rights are now an essential part of all programming and community capacity building projects in the country. Policy. Termination of pregnancy by a recognized medical institution within period permitted by the professions is not punishable where the pregnancy is the result of rape or incest, or the continuation of pregnancy endangers the life of the mother or the child or the health of the mother, or where the birth of the child is a risk to the life or health of the mother. The fetus has an incurable and a serious deformity. The pregnant woman, owing to physical and mental deficiency she suffers from, or her minority is physical as well as mentally unfit to bring up the child. Client and provide communication technique. This is mostly what is the role of the health professionals in healthy service areas. This is providers when we say healthy professional. Client when we say those who are coming to hospital or clinic or health center for to use the health any issue related to with health of reproductive or reproductive health. Providers should remember roles technique when communicating with clients. Roles, when we say it is abbreviation, R, relax the client using facial expression showing concern. Be free, not makes them to be afraid. O means when open up the client by using a warm and caring tone. L, lean towards the client, not away from them. Just nearby, lean when we say go near to them, not be aware, because maybe they need to talk or speak slowly. E, establish and maintain eye contact with the client so that you are concerned, so that you are understanding them clearly, and smile. Even if what they are speaking about is not making you smile, simply try to smile so that they can tell you whatever they want. This is what we call it roles. The other is a clear technique. Clear technique, when we say providers should always remember to be clear when communicating with clients. When you communicate, to be clear. Like clear, when we say see, use clear and simple language. The clients, they don't know medical words, so don't use medical words. Use the local words, which is very simple. L means listen to what the client is saying. Listen them. After that, you can just talk, you can reply, but listen. Just encourage them to speak whatever they say. E, encourage the clients that they will be able to use the method with a good results again. Which method is good, how they encourage them. Don't enforce them, but simply you can guide them. A, ask for feedback from client and acknowledge that their concerns and opinions are valid. Just ask them, how is it? Say them after the discussion. You should ask them what the client inform you is very good. So say that "Oh, you are telling me very good, very important issues. Say like that, so that you are encouraging them. The last one, or R, means have the client to repeat back the key point that you have told them about using the method. Just simply highlight them. Ask them to highlight. Do you understand what we have discussed? Then they will tell you at least the main points so that it is clearly discussed and they understand, so they can take into the what we call it into practice. The other is the gather technique. Gather technique. So these are the third one. The third one, don't forget, roll, clear, and the gather. Gather means provide should always remember the gather steps in counseling process. For example, when you are counseling for family planning, the first one means greet client friendly, helpfully, and respectfully. First, greet. The name of the client is written on the card. So when they come to your office, just call their name so that they are become happy. If their name is, for example, Muhammad, oh Muhammad, how are you? How is it? Freely, and your facial expression should be uh, good again. The second one, A, means ask client about family planning needs concerning the previous years. Before coming to your explanation, first ask, have you been used before? How is it? What is your opinion towards the family planning? So you should understand something from what the client said. Then T, tell client about different contraceptive options and the method. There are different contraceptive methods. What are these? Explain all of them, including their advantages and their disadvantages. It is up to them to select, but you should inform all of them with advantage of this is this one, advantage of this is this one, disadvantage of all methods again. H means help client to make decision about choice of methods she or he prefers. Maybe sometimes she will came with her husband. That's why we say she or he. contraceptive is given for I mean family planning is given for the female or for the wife, not for the husband. But why we say he or she here, sometimes some of the wife they will ask their husband to come to their to choose which types of the client to come to the decision they may help. You should help again. Which if they ask you which one is good, shall I use this one? When they say, just help them, support them to become to decide on which type they are going to use. E means explain to client how to use the method. Once they select, explain them. This you are going to use like this one, like this one, like this one. The last one is R, return. Schedule and return visit for follow up. Inform them. Some of them are maybe for 3 months, some of them are for 5 months. It can be for a year again, for 3 years, like that. So inform them on which days they should return back. This is what we call it gather technique. So how many techniques are there in clients and the provider procedures? There are major three. The first one is roles, second one is clear, and third one is gather. So these are the what we call it abbreviations. Don't forget this. So that's all about today's class, and that's all about the total reproductive health course again. So we have finished the courses, and this is the last for this semester again. So if you have question, please don't forget to write me on my WhatsApp. Then I will prepare final exam and I will send to your university and they will manage it. Good. I will tell you from which chapter I am going to prepare final exam. I have sent you your assignments, so please don't be reluctant to do your assignment. Do it clearly. Then you will ask it only the final exam and from which portion I will write you. So please write me on my WhatsApp. I don't know your monitor again. Please inform your monitor to write me on my WhatsApp. Then I will tell you all informations. Good. So see you. Please take care from coronavirus. Stay safe. Thank you very much. Bye.